I am originally from Holland, Michigan. Looking into the schools, I noticed that UAB was a good school. It was in the top half. I have some good friends in Connecticut that were from the South that encouraged me to. And when I was accepted at UAB and I was corresponding with Julie Brown, I heard back from her right away. I felt like I was treated as a person and not just an applicant number. So I set up an appointment to have a school visitation, and I heard back. It was planned within 24 hours. So by the time that I came down to visit, everything was in place and it felt right.
The most thing I enjoy about being a student here at the University of Alabama at Birmingham is the diversity in the student body. I am overwhelmed and awed by the diversity at this campus. I go to school and classes with people from India, from all the countries in the continent of Africa, Asia, and to be able to interact with them and ask them specific questions about their culture and their country is invaluable to me as a future health behavior scientist.
I was introduced to this kind of concept of public health and how all-encompassing it was, and instead of helping just individuals, it would be helping populations and communities, and I really liked that aspect of public health.
I chose UAB School of Public Health because of the research in HIV/AIDS that goes on here, and also the faculty for health behavior is really good.
One of the things I enjoyed most about my experiences here at UAB was the ability to also apply what I was learning in the classroom to the community.
I think my internship experience has been the best because it's also continued for me to be able to do more research as a part-time job. So the connections that I made both at the hospital and the support that I received from my advisor during that time was probably the best experience that I've had.
I worked on a diabetes prevention program as a student here. I also was able to work on a cancer prevention program as a student here.
My most rewarding experience is being involved in the Public Health Student Association and also doing my internship at the UAB 1917 clinic.
The main encouragement I got from the faculty is that I'm entering a field where minority males, specifically African American males, are not visible. And they encourage me to really pursue my dream of becoming a doctoral student.
My greatest influence has been Dr. Susan Davies. She is my advisor. And when Dr. Sheva Shannon, who is a graduate of this program and is my supervisor over at Children's Hospital, encouraged me to start my own research project over there, Dr. Davies was incredibly helpful for me in terms of coming up with surveys and ways to assess what I wanted to find out in my research project.
My greatest influence here at the school has to have probably been my program director in health behavior. I could always come speak to her about problems and registration and ways I wanted to tailor my education. And now that I'm doing research under a professor, she's really started to turn into a mentor and open me up into what public health really means and ways that I can tailor my research.
My advisor, Dr. Kohler, encouraged me a lot. I had a special interest in health communications, and although there weren't many class offerings in the area, she encouraged me to go and find those opportunities.
My motivation is to continue with the sexual health promotion because back when I was in Africa doing work, I realized that the students there don't have the proper information, and also here in the States.
My first year, I came and I was awarded the Dean's Merit Scholarship, and for my second year, I was awarded the HRSA Public Health Traineeship Award.
I am determined to complete my degree program. I believe that I've learned one of my favorite mantras is, if you think you can or you think you cannot, you're right. And so for me, I think I can, and I'm determined to graduate and further enhance the knowledge around health and health education and awareness in the community.
After graduation, I hope to pursue a nursing degree and also find a job with the HIV/AIDS organization in the States that also does work nationally and internationally.
I would tell other graduate students not to be afraid to try electives outside of their department. If they have the room, I took health economics and I'm in injury epidemiology right now, and I think it's just helped to make me more rounded, and it's doable even if you're not in the department, and I've really enjoyed it.
What I would like to say is for students to be involved, that there's a lot of organizations in the community that do a lot of great work, and to pick an internship that will really benefit them and get them to really know what they want to do.